Okay, ladies and gentlemen, it is 3:31, and I'm going to call the Personnel and Compensation Committee meeting to order, please. I would ask you to please rise for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Great, and can we have roll call, please?
Benton. Here. Fagione. Lujan. Riskevich. Here. Sierra. Here. Stiganga. Tortel. Sassy.
Here.
5 present, 3 absent.
Great, thank you. Good afternoon, everyone. It's a dreary day here. We have 2 items on our agenda today. First up is Commissioner of Social Services and Mental Health, Darcy Miller, a request to hire staff social worker and staff social worker Spanish English speaking at grade 16, step 4, currently starting at grade 16, step 2, legislative request number 237. Do I have a motion and a second, please? Sierra and Benton. Legislator Tortel has joined us. Okay, Commissioner, the floor is yours.
Good afternoon. Thank you for considering this request. We have currently 3 vacant staff social work positions which require a licensed clinical social work credential. We have a 4th also vacant. We haven't put into hire yet because we've not been able to get these positions to move forward. We thank our Department of Personnel for their great effort in marketing these positions. Unfortunately, even though we have received some resumes, one of our clinics did 9 interviews. None of them were interested in the positions. The other did 4 interviews. In fact, they were over the phone. They didn't even come in for an interview. So we are no longer competitive at our starting salary, and we don't have the flexibility that other operations are offering where they're able to do remote virtual work. So unfortunately, we are hopeful that increasing the starting salary will attract some to come and work with us. First time in my career that we've ever been in this position. Typically, people are racing to our staff social work positions. We lost 2 staff social workers, which is also very rare. They left to go to school positions. We're in a really difficult place. And this is about 350 people who could be receiving services with these positions filled. Without them, they're not receiving the service. And there's no cost to us because they're all revenue generating positions. So, every day that these positions are vacant, we lose money.
Yeah, understood. Any questions? Okay, all in favor? Anyone opposed? Great, thank you very much.
Thank you very much.
Good luck.
Appreciate it.
Number 2 on our agenda is our Commissioner of Human Resources, Stephen Gross, request to create sign-on bonus for Valley View to address staffing shortages, legislative request number 252. Do I have a motion and a second? Motion, Legislator Fagione. Second, Legislator Tortel. On the rear of the sheet that you have there kind of gives you an idea as well, so if you want to follow along, but I will let the 2 commissioners explain the sign-on bonus. Gentlemen, the floor is yours.
Thank you, Chairman. So we're coming before the legislature to address some market conditions, as we just did with social services. We're having some issues at the nursing home, which I think everybody's aware of, trying to get employees in. I believe last month we also took action with regard to a similar issue with the health department. So we're trying to be nimble and adjust to market conditions that are out there. We're all experiencing issues with attracting workforce, not just in the county, but also in the private sector. So what Lawrence did, he did a really good job working with seeing what a lot of the local nursing homes are doing with respect to sign-on bonuses. I've said it many times, government is a long game for employees, where we're now competing against the short game, people that can pay a lot to get in the door. Where you work for the government, you're gonna do well, but it's not gonna be necessarily the day you walk in the door. There are other benefits. There's obviously pensions and health insurance and things like that that come with municipal employment. So I'm going to let Lawrence present the actual sign-on bonus program. We have it here in front of us. We think it's a good program that will help to bring in additional employees.
Thanks, Steve, and thank you, Chairman, for getting us on the agenda today. We really appreciate it. So I did some research, and we found out what local facilities are paying for nursing staff, and Their bonus programs are located on the bottom of the sheet. As you could see, I got information from Shavir Pavilion, which is also a not-for-profit, and St. Joe's. They're owned by Bon Secures, I believe. They're currently offering a $3,000 sign-on bonus, total sign-on bonus for RNs, a $2,000 total sign-on bonus for LPNs, and a $1,000 sign-on bonus for CNAs. Each of these are paid out after you reach certain marks as far as employment dates. So for the nurses, $1,000 are paid out after 90 days, $1,000 are paid out after the first year, and $1,000 after the second year. For LPNs, they do $1,000 after 90, $500 after first year, and $500 after the second year. And then CNAs, $500 after 90 days, $250 after the first year, and $250 after the second year. I did learn that Middletown Park Manor, it's a privately owned for-profit nursing home, is also offering a $3,000 sign-on bonus for RNs and LPNs, but I didn't have the details on how they structured theirs. So what we wanted to do to remain competitive in the marketplace was to offer our own sign-on bonus program, but not only the sign-on bonus program, but also a referral program for our staff, our current staff. So what I'm proposing is that we have a slight increase of our bonus program up to $3,500 for RNs. Again, $1,000 paid after 90 days, $1,000 after the first year, $1,500 after the second year, up to $2,500 for LPNs, $1,000 after 90, $1,000 after the first year, $500 after the second year, up to $1,500 for CNAs, $500 after 90, $500 after the first year, and $500 after the second year. And we'd like to offer a $500 referral bonus program to any county employee who is a CSCA member that refers an RN, LPN, or CNA to Valley View. That those people that do that, $250 will be paid after a new employee completes 90 days, and $250 after a new employee completes 6 months. And we'll track this by, we'll have an attestation form that is completed by the new employee, the potential new employee upon their interview. We'll ask if anybody referred them to Valley View right there on the spot, so they can't come back to us later after they've been hired and say, oh, you know, John Smith referred me, just to get the program, just to keep it on the up and up. What's that? One name only. Yeah, one name. So, yep.
Okay. Couple of quick questions. The union is here. Union is on board with this? Yes. Okay. I know, I want to thank Commissioner Ledoux and Commissioner Gross. I know this was added last minute, but this has been ongoing, and everybody knows about the labor shortage. And I'd like to thank fellow legislator Jim O'Donnell, and again, to Commissioner Ledoux. We've been attending the Valley View Family Committee, it's not the
Family Council.
Family Advisory Committee, and that has been one of their main concerns, that there is a shortage there, and it has nothing to do with the county. It's simply that the world that we live in here. So we just heard Commissioner Miller, she's not attracting people. It's the same thing here. We're currently at what, 71% occupancy?
Correct.
So if we don't have it staffed, we're not going to be able to add residents and take care of the people of Orange County. So I think this is aggressive. I think it's needed, and the sooner the better. So we have it on here today. Commissioner Gross, did you want to add to that?
I just wanted to jump in and also thank Denise from the union. Denise Fuchs is the president. Denise and Vanessa, who represent the union, came in this morning, met with us, understood the gravity of the situation, agreed to this today, and that's why we asked to have it put on the agenda. So I thank you for putting it on the agenda for today and your consideration, and I believe it'll be on health and mental health tomorrow as well.
Great. No, I think this entire committee here understands the urgency, and we'll no doubt support it. Any questions for either Commissioner? Legislator Fagione.
Thank you, Chairman. Just a couple of questions, and maybe not the answers. You may not have the answers right in front of you. Is there a chance you could shoot us an email and give us a breakdown of how many RNs, LPNs, and CNAs are currently employed? How many vacancies exist there? And can you put some goals to what this plan is going to do? Are there goals that you have in mind? Are you looking to get 20, 30, 50 people? That's number one. And number two, how do we keep these people here? I see that this is extended out for 2 years. You know, money will be paid 90 days, first year, and then second year. After that, is there any expectation contractually to keep them? Or do we just think by then they'll want to stick on?
It'll be totally up to the employees whether they want to stay. I think the whole idea about this proposal is to get the people in the door, and I think they'll see that we have a great working environment, and obviously, the other local facilities can't compete against the county's benefits, and paid, quite frankly. Well, the pay is started, their pay is starting to catch up to us, but as far as benefits, they can't compete with us, and as far as our working environment, I think we have an outstanding working environment. So the idea really is to get them in the door, and hopefully they'll stay 2 years and maybe refer somebody else, and especially if they come from, another facility or another working environment. So that's the idea. We do have 2 units closed right now, so the idea is to, hire enough people that we can reopen the units. That is why our census is 71% right now. We had to close the units based on our current staffing measures. So, we want to provide appropriate care. We have a number of budgeted empty positions for RNs, LPNs, and CNAs, and I can easily get that for you.
Okay, and just to follow up on that, Chairman, and thank you for those answers. Potential employees that come in, how quickly can we spin them up and get them hired? Is there any delay in getting, are someone tomorrow comes in and is certified and of accreditation, will they be hired shortly? What's the turnaround for that kind of?
They have to, we need an application and file, we have to get health records in place, but it could be, we've sped up that process within the last 6 months because of what the situation that's going on now. And previously, when we weren't so desperate for staff, it could be a 2 to 3 week turnaround time, and we've shortened that quite substantially.
Lawrence, it might be also important to just let everybody know that the state has also a waiver program in place now for CNAs. So we can actually start people as CNAs, Lawrence, and actually get them trained along the way so that it helps us. They don't necessarily have to be trained the day they walk in the door. They can be trained along the way now.
Well, I want to thank the gentleman, and Chairman, just last,
Sure, go ahead.
I understand that this was a late addition, but this is strategy that shows that there's goals in mind to do what is responsible and to provide the best care that we can in that facility. So thank you, Chairman, for rushing this through to committee today.
No problem, absolutely. You see the teamwork with the union, with our human resources, and with Valley View. I've always believed it for years and years. Orange County is not only a great place to live and work, Orange County government and our entire workforce is a dedicated workforce, and we're all feeling the pains of this economy and the pandemic. So this, as I said, is an aggressive move, and I hope you fill a lot of those slots, and as Legislator Fagione said, give our residents the care they deserve. Thank you, well done. Anyone else? Legislator Tortel.
Thank you, Mr. Chairman. You did address the one issue that I was concerned with, was our unions being on board with this. So thank you for that, and thank you for also putting in place an incentive for them to refer workers to Valley View. It's definitely the jewel of the county, and my hat's off to all the people who have toiled there for many years, and especially during this most recent pandemic. In regards to the pandemic, I know you're not prepared for it, but do you have any positive COVID cases currently in Valley View?
No.
Thank you.
I don't think we have any staff out right now. We may have one staff. I think I sent everybody in the health and mental health an update Friday, I think. So we're in pretty good shape right now, like I said, knock on wood.
Yeah, I know the tides can change very quickly, so thank you. Thank you, Mr. Chairman, and could you please add me to this resolution? Thank you.
Okay, any further questions? Seeing none, we're good. Thank you, gentlemen. Have a great afternoon.
Thank you again, and we appreciate it.
Our pleasure. All in favor? Anyone opposed? So carried. There you have it. Okay, motion to adjourn. Okay. Have a good afternoon, everyone. Thank you.